This morning, I'm happy to welcome Dr. Sarah Jung. Dr. Jung completed her undergraduate degrees in psychology and international studies at the University of Minnesota Duluth. She then received her PhD in educational psychology with a focus in learning science here at UW, before joining the faculty here as an assistant professor in the Department of Surgery. Her research focuses on developing learner-centered training environments and studying how perceptions of and experiences in these environments influence learning trajectories in medical education. Currently, she's pursuing work in investigating how discrimination and systemic inequities experienced in the clinical environment impact education, advancement, and career satisfaction of health professionals from historically underrepresented communities. Please join me in welcoming Dr. Jung this morning.
Thank you, Dr. Bizzuto, for that very nice welcome. And it's really great to be here with all of you today. I always feel a little awkward presenting virtually, especially when I can't see everyone, but I see a few folks in the tiny square on my screen. But welcome, and thanks for being here with me. I do see Jay Lick, who was my person when I had my son just a couple of years back. So hi, Jay. Nice to see you again. So I was really racking my brain trying to figure out when I got the invitation what we could talk about today that was going to be useful. And I landed on feedback culture for a few reasons. One is that, I think, and as we'll talk about in a little bit, no matter how many times we learn about feedback or think about it, or, many of us know, what we're supposed to do and how to go about giving feedback, but yet in the moment or in the clinical teaching environment, it can be really difficult. And so I thought I would talk about feedback in terms of, well, here's what we should do. Here are some ways to approach feedback. These are things we've known for a long time. So then what are some things that may prevent us from doing that, right? And what are some aspects of the learning environment that may impact our abilities both to give and receive feedback? So before I jump in, I want to talk a little bit about the platform that I'm using. So it's actually an interactive presentation platform called Mentimeter. We were chatting a little bit before the session started about how, especially now, we've all been trying to figure out new ways to teach virtually. And I found Mentimeter to be a nice software in that you can build presentations in it as well as add interactive components. And so a lot of the components function similarly to something like Poll Everywhere, but it's also designed to let you build presentations. So I thought I would give this a try, both in terms of making the presentation more interactive, as well as sort of illustrating to you all a piece of software that you may find useful. Just as a side note, you can get a free version of Mentimeter on their site. It doesn't have all of the functions of the paid version, but it still allows you to think. To participate, you can go to menti.com and use the code at the top of the screen that will appear at the top of all the slides. So it's 29209360. That will allow you to participate in the questions, as well as you can see in the corner here that there's options to give a like or a heart. So if there's a slide or a topic or something that particularly resonates with you, you can go ahead and give it a like as well if you feel so inclined. I think, and Lisa, I think you were also going to, thank you. I saw someone just did it. There's also a link that will allow you to join the presentation directly that we can put in the chat. But again, if you go to menti.com and use the code, you should be able to do that. And it looks like people are getting in. Okay, so now with all of that out of the way, I'm going to go ahead and jump in. There we go. All right, so who am I? As Dr. Rizzuto said, I'm an educational psychologist. My background is educational psychology with a focus in learning sciences. And so what does that mean? It basically means that my area of focus is on how we design learning environments in ways that allow us to meet the learning objectives that we set out for our students, but also meet the needs of our students. And so I've done work in a variety of different areas. When I was doing my graduate work, I was focused on actually K through 12 education, particularly in middle school classrooms, trying to better understand how students learned about scientific concepts through things like online texts and simulations. So how did I end up in medical and surgical education? Well, as I mentioned, my background is really focused on understanding learning environments broadly, and this can be things like what we might think of as informal learning environments, things like museums or outdoor learning, as well as things like workplace-based environments like medicine. And so when the opportunity arose for a position in surgery, doing both surgical education research as well as helping to develop surgical and medical education programs, I jumped at the chance, and I have been here ever since 2014 and really, really enjoyed it. And the other reason I tell you this is so you know kind of the perspective that I'm coming at this from, right? When I think about the design of learning environments, I really think about how we can use things like educational and psychological principles and theories to really inform our teaching. And then also how we can take what we've learned from our teaching to inform how we understand learning in these environments. So what are we going to talk about today? We have a few learning goals. As I mentioned, we'll review some of the fundamentals of giving and receiving feedback. We'll talk about why and how culture and the culture that we set up around feedback may impact the success of the feedback that we give and receive. We'll try to identify elements of culture that may make feedback more or less successful, right? So what are some things that we can actionably work upon and try to change? And then originally, this goal had been written as explain. And I thought that as I thought about it more, you know, it was a little too hard. Like I'm not, you know, saying I'm coming in here and I'm going to explain, you know, this is how you do it and it's going to work perfectly. You're hopefully going to leave here today with some ideas that you may be able to incorporate into your practice. So I thought a better way to phrase it would be ideas, right? How to create a culture that facilitates asking for and receiving feedback. So that is what we are hoping to accomplish today. All right, so we know that feedback is important, right? We need to understand where we're at in our learning and where we are in terms of our goals in order to work towards improvement, right? And feedback is important not only in education, but in other fields as well. There's a large body of work on feedback in the fields of psychology and business, as well as education that inform each other. And also, you know, right, this is not a new concept in medical education. The pointers I'm going to be talking about on the next few slides are actually coming from a JAMA article that I really like. That's from 1983, right, by Jack Endy, talking about feedback in clinical medical education. But if you look at resources on feedback, right, and what good feedback looks like, basically you're going to find some version of everything that Dr. Endy talked about in his JAMA article in 1983, right? And, you know, probably even further back than that. So again, we know these things are important, and let's kind of start out with some of the fundamentals. All right, so a review of what we know. We know that feedback should include both the teacher or preceptor or trainer, as well as the trainee, as allies with common goals, right? We should be on the same page with what it is we want to learn and accomplish, right? And often that can be facilitated through things like conversations or setting aside time to talk about goals. And a little bit later, we'll brainstorm some more ideas for that. It should be based on firsthand data, right? And what I mean by that is that to the extent possible, it should be based upon things that you have actually observed the learner do, right? It's much more difficult to give feedback based upon something you've heard about a learner or something that a colleague may have said. So that firsthand data is really important. It should be reasonable in quantity and focus on changeable behaviors. So what do I mean by that? Well, reasonable in quantity, you know, most studies and work that's done will say to limit it to, you know, 2 at the max 3 sort of major points that you want the learner to work on, right? Anything above that just really kind of gets overwhelming and can be difficult to plan actionable changes, right? And so to that second part, then it should focus on changeable behaviors, right? So rather than making sort of broad statements about someone's behavior, focusing on something specific that was done, right? And so an example might be, you know, rather than saying, well, your differential diagnosis was incomplete, saying something like your differential diagnosis lacked these specific elements, right? And so the learner knows what they can change the next time. And this last point, be well-timed and expected. So I think this is something that can really be a challenge in medical education, right? We can't always plan specific times to sit down, give feedback. Sometimes we can, but you know, sometimes it happens in the moments between patient care or maybe when something critical has occurred, right? But even still, one thing that I often talk to folks about is thinking about, you know, what are the situations in which it may be most appropriate both to give feedback, but also to ask for feedback, right? So I'll often talk to learners about situational awareness, right? Trying to figure out, you know, what that it may make the most sense to ask for feedback on something that you're doing. So I would like to ask all of you, and you should be able to use your mobile devices to respond, to think of some times when people might not want to receive feedback, right? When are some times that learners, you know, may either not want the feedback or also not be able to process the feedback fully, or maybe not even recognize that they're receiving feedback. You know, we get a lot, at least here in surgery, we'll talk to folks about feedback and they'll say, well, I don't get feedback, right? I'm not sure that and I shouldn't say that. They certainly get feedback, but they will say, I don't feel like I'm getting as much feedback as I should. And then we talk to other folks and they say, well, I feel like I'm giving feedback all the time, right? And so we have this disconnect between what people feel like they're doing and what the learners perceive. And, part of it may be just the timing of the feedback. So let's see what people are putting up here. Some great ideas. What, right, when they realize they perform below their standard, right? And in a bit, we'll talk about, why that might be, right? But if you're already feeling like you didn't do as well as you had hoped, getting that reinforced, even though it's valuable for learning, can be challenging. And so how do we deal with that? And then, a lot of people are talking about things like when you're really physically tired, after a long shift, immediately after a poor outcome, right? Because you're dealing with the, all of the anxiety and stress that goes along with that. And yes, someone says when they're stressed, right? The sympathetic pathway discourages long-term knowledge integration, right? Or in front of others, as someone put up, if that may be difficult for learners to incorporate if they are stressed or worried about, what it looks like in front of their colleagues, right? And so, this comment sort of hit it on the head here, right? We're trying to think of times when learners might actually be able to incorporate the feedback that we're giving to them and have the cognitive resources to really think about it and utilize it. And then, when they disagree with the assessment or feedback, right? And so we'll talk a little bit about that too. Certainly that is a component of how we utilize feedback, both thinking about, does it sort of resonate with how we see ourselves? And then also, what is our relationship like with the person who's giving us that feedback? And that can actually have, a big impact on how we use the feedback that we may not immediately agree with. All right, I have another question for you all. So thinking about it from the teacher side, what are times when people might not want to give feedback, right? When may not be a great time, right, for teachers or trainers or preceptors to be giving feedback to their students, even though from a learning perspective, it might actually be helpful for the student to receive feedback in that moment. Yeah, in a time pressured setting, and some people, probably see that and say, well, when when isn't there, right? But particularly if things are very highly time stressful, that is a difficult time to give feedback. What else comes to mind? Mm, yeah, so when the feedback may feel like it's personal or character related. And so, we can some strategies to try to help deal with that, right? And rather than talking about it as a character trait, and again, this requires some thought and often isn't the best kind of feedback to give on the fly, right? But rather than saying something like, you're really too slow with your patient presentations, for example, talking about ways that a learner might organize their presentations and key points that they might hit on to make them faster, right? And so then we've switched it away from talking about a characteristic to a particular behavior or thing that they can change. Yeah, when the one giving feedback has strong emotions regarding the feedback they want to give. And, probably in medicine, this is more prominent than in any other learning environment, right? We're working with patients, people that we care very much about, and decisions that learners make can impact our patients. And so, the feedback can also sometimes be emotionally charged. Yeah, when the learners feel like maybe when the person feels like maybe they don't have the skills to give the feedback. And yeah, I mean, again, as I was saying at the beginning, giving good feedback, like many things in life, it seems like it should be easy if you lay out, well, here are the things to do. But in practice, it can be really difficult, especially, given all of the other things that you're bringing up here, right? If you think it's going to impact your relationship, if the perception is that the person is going to be unreceptive, again, when you're busy. And then also this one, if the feedback is repetitive. And so that's another challenge, right? If you feel like it's something you've addressed with a learner multiple times and it's still, sort of not coming through, right? Then taking a step back maybe and thinking about, well, why might this be, right? And how might I work with my learner to figure out how to make progress in this area? Yeah. So, again, when we start digging into it, there are a lot of potential challenges to giving feedback as well, which again we'll continue to talk about over the next few minutes. So just to sort of continue in our review of what we know, and a lot of this we've actually talked about in the last couple of slides, feedback should be descriptive and not based on value judgments, right? And so, rather than saying something like, and this is, a strong example, I don't think any of you would ever do this, but saying, you're really bad at X, right? Saying, again, pointing out what is it about a certain thing that you want a learner to change. And that kind of relates to the next point, that it should really deal with specific performances, right? And this is really important too for helping learners to integrate these changes into their working and then their long-term memory, right? It's difficult to work with generalizations and think about, well, what should I change, right? But if you're able to talk about a specific situation with a learner that they can then reflect on and think about, what specific things they may have done differently, that can be much more helpful. Allowing time to check in with the trainee about potential interpretations. Again, asking learners, how do you think that went, right? And then, talking through feedback, and then at the end, making sure that the learner has, understood the feedback and the plan for moving forward. And then finally, and again, this sort of reinforces a lot of what we've been talking about, dealing with decisions and behaviors rather than assumed intentions, right? So, rather than talk what you think the motivation was, digging into, well, what were the decisions made and why, and how could that have been done differently? All right, so those are some of the basics of good feedback. So what are the barriers to doing these things, right? And we've already talked about some of them. So this is another question that's sort of related to what we were just talking about when you might not want to give good feedback. But what do you think prevents you from giving, quote unquote, good feedback, right? What might prevent you from doing that? anxiety. Yeah, anxious about doing it, about saying the wrong thing or doing it the wrong way, having it land wrong with the learner. Again, we kind of brought that up in our last question. What else? Effort. Mm-hmm. Yep. Um, right. We need to be able to make the time for it and, spend at least some time figuring out how we're going to deliver it. Tone, right? And again, especially if things are emotionally charged, coming up with actionable items. I think, um, yeah, again, time, emotion, skill, and honestly, part of developing feedback skills is practice, right? Continuing to do it. But the reason I'm having you respond to these questions and now do this word cloud, other than the fact that I like word clouds and think they're really nice for kind of showing what some of the big themes in people's thinking are, is that you're not the only one, right? You're not the only one who has barriers to giving feedback, who, may be anxious about it or not quite sure how to deliver it or feel like, maybe you're not skilled enough at doing it, right? And so, um, again, we all have these barriers, but part of getting better is thinking about, well, how do I fit this feedback into the teaching that I'm doing? So as we're thinking about some of these things, then I want to kind of take a step back and talk a little bit about some ideas around theories that can inform our understanding of feedback in the clinical environment, as well as thinking a little bit about culture. So social cognitive theory is a pretty well-known theory in the psychological literature, as well as many other fields, and I think is a really nice way to help us think about at least some aspects of medical education. So this theory was first put forward by Dr. Albert Bandura, and this is me as a fresh-faced undergraduate actually getting to meet Dr. Bandura and hear him speak. So any of you who have taken a psychology course have probably heard of him and his Bobo doll experiments, which looked at aggressive behaviors in children after viewing them in adults. Anyway, his perspective is really that as we're thinking about learning in any sort of learning environment, right, we need to consider multiple factors, right? We need to consider the person and any sort of internal psychological factors that they may be bringing to the situation. So things like motivation, self-efficacy. Obviously, we need to consider the external observable factors, right? The behavior, what are we seeing? And then we also need to consider the situation, right? What is happening in the moment, and that all of these things really combine to create the environment in which learning might take place in multiple fashions, either through observations or through other mechanisms. And so let's unpack this a little bit. So behavior, we're talking about things like understanding how to perform a behavior, right? You have to have the skill and the ability to do the behavior. But these are really the external observable factors. And so behaviors, as we've talked about, are really the things that we're focusing on as we're thinking about giving feedback. The situation, Again, focusing on ideas around observational learning. What am I learning from others in my environment? What are things that are being reinforced or rewarded, and how do I know that those things are going to be reinforced or rewarded? And we can think about that in terms of discriminant stimuli, right? How do I know what to do in a particular situation? And these are all things that our learners are working to figure out. And then another big part of the situation is the relationships, right? What kinds of relationships do I have with the people that I'm learning from that are going to influence, for example, the way that I may receive feedback? And then finally, the person, right? So self-efficacy, right? How much do I believe in my ability to perform in this particular instance? And obviously, this probably changes throughout training, right? So coming in as an intern, you're probably much less self-efficacious than you are, as a chief who is graduating. What do I expect, right? What are my outcome expectancies for the different behaviors that I engage in? And then and I think this is a big one when it comes to feedback, right? Self-regulation and thinking about, what are my skills in terms of understanding what feedback might be helpful, and then how I might integrate that into making behavioral changes. Right. And so this is just kind of illustrating, some of the things that are in play in these complex environments, right? With the person, the situation, and our behaviors. So I think this is a nice way to represent this in terms of feedback. And so this is a relatively recent model that's been developed called the ready, willing, and able model of successful feedback use. And so essentially looking at, right, hearing the message, understanding the message, right, being on the same page with the person who is giving the feedback. And then, again, some of the things that we brought up previously, is the message valued or not? How does it compare to my own self-judgment? And then how do I take that and think about how I might change my behavior or my performance in some way, right? And so, if it's valued and it's perceived to be useful, this will engage motivation and then allow for the employment of adaptive learning strategies. So I think we also need to think about then proactively receiving feedback, right? There's giving feedback, but then there's also receiving feedback. Kind of a nice model is this SAGE model. And SAGE essentially stands for self-appraisal. So thinking about where am I at with regard to where I'm supposed to be in my learning trajectory, right? And what else do I need to do to get there? And this relates to the second part of A, or the assessment of expectations, right? And that's why it's really important that learning objectives are clear for our learners, right? Because if you don't know where you're expected to be, it's hard to engage in that self-appraisal. Goal setting and self-regulation, right? Okay, knowing where I am and where I need to be. What am I going to do to get there? And then, all of this is related to this idea of innovation, right? To engage in all of these things, I need to be motivated to take the feedback, incorporate it, and use it to move forward. So this begs the question then, what are some things that might prevent a learner from fully embracing feedback? And I know we brought up some of them earlier, things like, being tired or stressed out. But are there other things you can think of that may influence a learner's either ability, right, or desire to embrace the feedback, right? I mean, disagreement, perception, not agreeing with the feedback or thinking that it's unfair. Yeah, again, being tired. Time in the training program. Mm-hmm. Yeah, and you know, some of these I'm sort of guessing what you're meaning here. If we were in person, I'd have more discussion around this, but you know, I think time may be related to this idea of, you know, that as you move further in the program, you have a better idea of where you need to get to, or you know what the expectations are, and so it can be maybe easier to incorporate some of that feedback, or potentially as you get further along, you may feel like you know more than you actually do, and so you know, potential for disagreement, for example. But if you look at some of the commonalities of these, right? Disagreement, how they perceive the person, not agreeing with it, right? A lot of it is about relationships, right? And even if we disagree with something, if we have a relationship with the person that we're receiving the feedback from, we can have a conversation about it, right? And so it's much less likely that we'll just sort of, you know, shrug it off and not do anything with it. But you all have hit on, you know, a lot of the things that come up here in the model as barriers to the successful use of feedback, right? Things like poor calibration, you know, misaligned expectations, emotional interference, jargon or limited understanding, and then you know, feelings about the messenger, as well as potential issues with, you know, integrating it into kind of how we feel about our performance ourselves, right? How do we create that narrative where we can integrate this new information in a useful way? So culture impacts this, and why and how does that happen? So I do want to spend a little bit of time on this because I think input from you all is important as we talk about this. But just generally, if someone says to you, what are some things that make you feel safe, right? What might you say? What gives you a sense of safety? Space? Being known? Yeah. Feeling like people really know you and who you are. Breath, being able to breathe. Rapport, again, about that relationship. Commonality, right? Feeling that we connect somehow. We can be ourselves, but also we connect with the people around us, right? Peers. Having some control. Yep. Both of ourselves and our space. Feeling valued. Absolutely. It's much easier to receive feedback, particularly critical or constructive feedback, if you feel like a valued member of your organization or your team. Absolutely. And reassurance, right? And particularly reassurance that, you know, it's normal not to be perfect, and like feedback is what helps us to be better, right? Yeah. So the reason I bring that up is because psychological safety is another thing that's really related to a culture of feedback. And psychological safety is a shared belief that it's safe to engage in interpersonal risk taking in the workplace, right? And as we brought up in our responses, both in giving feedback and also in receiving feedback, right, we're taking a risk, right? We're taking a risk that we may somehow change the relationship with the person we're talking with. With performing and getting feedback, we're taking a risk in, showing that we're not perfect and that, we have areas to improve. So these are related to some of the institutional challenges that previous work has found when looking at challenges to feedback, particularly in medical education. Some things that have come up are ideas around a culture of politeness, sort of discouraging language that might be perceived to threaten self-esteem. I thought these second two were interesting. Overemphasis on a culture of excellence as well as institutional reputation, right? So like thinking that people should already be good, right? And not need feedback on areas for improvement. Other potential issues to address, right? Or how might we deal with some cultural issues? Obviously, normalizing constructive feedback and promoting a culture of growth, right? Both for our trainees as well as for ourselves as practicing physicians or patient care providers or medical educators. Another thing that can be difficult to overcome in the medical environment is this idea of hierarchy, right? It can be difficult to provide that bi-directional feedback. And then overcoming mental blocks to seeking feedback, right? Trying to get over this idea of needing to be perfect. So how might we make our feedback exchanges more successful then? Some things to think about are assessing our own feedback, right? And so this is an example that we've used in some of our work of a third-party assessment form for feedback. And this could really be used for self-reflection as well as, asking a colleague or someone to observe you giving feedback or even to read some written feedback that you've given to a learner, right? And talk and, think about how well did I set goals, right? Did I really, focus specifically on behaviors and areas for improvement, for example? Assessment of learners for giving them feedback. So what do I mean by this? Well, for example, in our department, we've developed a smartphone app for giving feedback to learners. And so they're rated in terms of their independence on different types of cases. And then they're also given specific written or dictated feedback on why a particular level was chosen. And then we've developed a dashboard for learners to see kind of where they've been rated by different attendings, as well as a place to summarize the written comments that they've gotten. Right. And so I think, another thing that can be an issue is that if you're getting feedback at all of these different times and there's not really a way to compile it all and sort of think about what is it telling you as a whole, that can be challenging. And so that is something that we've worked on as a department. Also, if anyone has interest in this app, let me know. Assessment and feedback for trust of learners. So another big thing that has come up in the medical education and feedback literature is this idea of getting feedback on ways that learners can develop autonomy and progressive trust and entrustment and sort of finding the sweet spot. And this, if you haven't heard of the Keyline podcast or Key Literature in Medical Education, it's great. I love it. I would suggest checking it out. The last episode was this new work from Ginn et al. On supervisor trust and learning. And essentially they looked at, I think it was a pediatric residency, but different ways that residents felt like they were given trust by their attendings and what that meant for their learning. And they kind of broke it down into sort of an optimal trust area, right, where they felt like, they were given enough autonomy, but not too much that they didn't feel, like they could learn from the situation. And one thing that you'll notice here is that, bi-directional feedback, right, is a really important component. Self-assessment of feedback. So this is there's multiple ways you might do that and try to reflect on the feedback that you have given. These are some questions for self-reflection from a modified Maastricht clinical teaching questionnaire, right? But just thinking about what do I do in my interactions with students, right? Do I offer them sufficient opportunities to perform independently, for example, that then I can give them feedback on? And then, I think we can also think about assessment of feedback by learners, right? So getting feedback ourselves from our learners. And I think it can be challenging sometimes to figure out how to do that and how to invite that feedback. And so the question that I pose to you here is, what are ways to request feedback from your learners? Yeah, you could have a formal assessment form. Absolutely. How am I doing? Yeah, anonymous surveys delivered in batches, which I think some of us do, or a lot of us do already, right? We ask for feedback from our students. We try to make it anonymous and aggregated so that they don't feel, they feel comfortable giving that feedback. A quick debrief, right? Informal questions. How do you think that went? Yeah, in the moment at an end of a shift, using the teach back method. I love that someone brought up the teach back method. And I think it can be used on both sides, right? Asking a student to repeat, what you've talked about in terms of feedback and things for change, but then also, asking about your feedback or what people think could be done differently, and then, repeating it to them, teaching it back to make sure you've gotten it. So yeah, there's both formal and informal ways to do that. I know one of our attending surgeons at the end of most of her cases, she just says, okay, what do you think we could have done differently there? But then she'll ask, is there anything you think I could have done differently? Right. And it really opens up that space for a conversation with her learners. So the last thing I want to briefly touch on, and then you all have been so engaging that we've had a lot to talk about, but this idea of increasing equity, right? And so I think, as we're thinking about methods for giving feedback, right, we also need to think about, are we doing it in a way that
I guess we will wrap things up here. And thanks everyone for joining us. Thank you, Dr. Jung. If you can hear us, we'll send you a message here, but thank you so much for joining us. This was a really excellent presentation. If anyone does have any questions for her, please send them my way or to Lisa Scott, and we can get those to her for you. All right, thanks everyone, and please enjoy the day.